OHCA. This is Linda Kirschbaum and Jim Carlson with the Oregon Healthcare Association, and we're pleased to have you with us today. Alongside with our GPO partners, Incite Strategic Partners, and Sysco joining us today, and we'll introduce you to those teams momentarily. But first of all, I would just like to say on behalf of all three partners, in particular OHCA and our board of directors, we want to extend our sincere and heartfelt appreciation to all of you and your teams who are out there just working hard every single day. You know, the long-term care staff truly are the heroes in the COVID-19 pandemic, and we just want to acknowledge all of your courage and dedication, and are inspired by all of the efforts that you're doing each and every day to keep your residents and staff safe. So keep up the great work. And today our goal is to really not take too much of your time, because we know you're busy and now exceptionally even more busy. So number one, we want to offer you support. We've been here, we've been working, you know, 24/7 on the job alongside of you with these partners at Sysco and Incite. So today our goals are to really update you on briefly on the advocacy and some of the actions that have been going on here in Oregon, especially those that impact your food service and procurement. Give you timely and up-to-date information. Our partners with Sysco are working diligently to make sure that we're a priority, and obviously the food production and distribution channels have been impacted by this crisis, so we'll give you some very timely and up-to-date information, and then more importantly, what Sysco is doing to make sure that we remain a priority and that we can deliver quality goods and services and meals to our residents. And then lastly, our partners with Incite are going to share updates and program enhancements. We kicked off that program on January 1. Little did we know that at the beginning of March, our world would get turned upside down. But aside from that, lots of great work happening there, and I think you'll be interested in hearing that. And then most importantly, answering your questions. So we will do we'll do presentation, and we'll be monitoring questions that you can type into the chat bar, and then we'll open it up for questions at the end. So jot those down. We'll stay until we get all of those answered for you. So with that, we're going to jump into just a little bit on what OHCA has been working on alongside of you, alongside with our national partners as well at AHCA, NCAL, and Argentum. DHS has been a stellar partner in this, and we have we couldn't be more grateful, as we've all just been focused on mission critical, and that is, you know, basically working to save the lives and make sure that we're protecting you, your staff, and the residents that we're serving. So April 28th, I think that's the date we won't forget, and OHCA, the partners at DHS, we literally are on the phone in collaboration with each other each day, Saturday, Sunday. I don't think we've had a break yet, so just trying to problem solve, communicate, and get the information that you all need to do your job, get the supplies out there for you to do your job. The department has chosen to really be in a technical assistance mode, and so instead of conditions, they went with the strategy to issue executive orders when we are finding that we have positive or pending cases of COVID within buildings. We think that those actions have been extremely important in really keeping the COVID spread to a minimum in long-term care. So great applause to everyone. We've just posted stats on our website, and 97% of the 670 long-term care licensed communities and facilities in our state are COVID-free, and that's really pretty remarkable. If you look at the press too long, you can get really jaded, but you and your teams are doing a fantastic job out there.
Sysco.
Right, let me go back. We're also moving the OHCA business from managed at the Portland location only to managing it at a corporate level. And the reason for that is the significant growth that we have seen with this account. And we want to continue to support it best we can and dedicate some additional resources. But more on that to come at a later date. But to echo Linda's comments, first, before I start, a sincere thank you to the folks on the phone today. I know your world has been upended, and while most people are home, sheltering in place, you are working even harder than ever, protecting and serving the most vulnerable population that we have in our country. And in looking at the results, it's truly remarkable and a testament to the work that you're doing. So a sincere thank you for that. The purpose of today's call is to update you on what happened relative to this pandemic, what challenges Sysco is facing. More importantly, what challenges the food industry is facing, and then what we're doing, more importantly, what we're doing to continue to support you. Obviously, our service levels have not been what you're used to, and I certainly apologize for that. Unfortunately, we're dealing, as you are, with some unprecedented disruptions in our business. So just real quickly to give you some sense of Sysco. And Sysco, we're about a $65 billion company worldwide. We do about $50 billion in sales in the continental United States. Within a 3-week period, our sales went from $50 billion to $20 billion. Hotel business is down almost 90%. Restaurant business is down almost 70%. You can just imagine what that has done. And not only does that impact us on the revenue side, it's a triple whammy. We've got all this inventory in our warehouses that we had stocked up in anticipation of a normal economy. And so not only do we lose the business overnight, but we have a risk of loss of inventory. Thirdly is bad debt and collection. So most restaurants, as you know, are not going to come back from this, and so we've already paid for the food that we deliver to these customers, and it's going to be a significant issue for us to collect some of that money. So it's been a very, very challenging time for Sysco in a very short period of time, and we've had to make some very rash decisions in order to continue to be able to operate as a business. Now, we are a very stable, well-capitalized organization. One of the first things we did was tap into our credit line and secured $2 billion in capital to make some of the investments that we're going to need to make to work through this. So obviously we're not at a risk of going out of business, but we certainly were at a risk of having some significant changes we had to make. So basically some of the things that we had to do that unfortunately impacted you, our customer, one is we had to immediately stop taking deliveries to our operating company. If you can think about your refrigerator being full, and you continue to go to the grocery store but not consume any of the food, you're eventually going to run out of room in your refrigerator. Well, basically that's what we were at. So we immediately canceled a lot of purchase orders and tried to use the inventory we had in our warehouses to meet the needs of our existing customer base. Secondly, significant layoffs and furloughs. First started at the operating company, and then same at the corporate office. So many people have lost their jobs or are not working at this point. Thirdly, we closed our operating companies. We typically operate 6 days a week, and we made the decision to close our operating companies on Wednesdays and Saturdays to take cost out of the business. And then finally, in good times, when we're doing $50 billion a year, we can offer many variations of a specific product. Bacon is always my favorite. You know, we in an operating company, we could stock 15 or 20 different SKUs of bacon. But you know, when our business drops off as much as it drops off, we're going to have to do some SKU rationalization and discontinue certain of those bacon products and only carry potentially 3 bacon. So as you can see, a lot of those things were necessary for us to continue operating and continue providing service to our customers. But we certainly understand the impact it had on you. We also, in that, had significant challenges relative to our business mix.
Did other people lose this?
The living was about 10% of our business.
Other people can't hear this.
No, they can hear.
It's now 40 to 50% of our business. And so one of the challenges we had is we didn't make that adjustment quick enough in product mix. So obviously restaurants and hotels don't necessarily order the same thing our healthcare and senior living customers order. So when we did get back up and running and we started ordering food again after we were able to clear the warehouses out, we were bringing in the wrong items. So we've quickly made that change. And then outside of that is our healthcare customers and senior living customers change what they're ordering, because now you're delivering meals to the room. So it's been very difficult for us to figure out what exactly it is that our healthcare customers need. So those things are some of the challenges that Sysco faced. On top of that, some of our ordering platforms send an immediate order confirmation once the order is submitted. Unfortunately, due to the things I just mentioned, when that order confirmation comes back, there's a lot of items that are out of stock, and that was causing a lot of anxiety on the part of our customer, because that's not what is coming the next day. That is the result of what is in our system at that time. What happens at that point, our account executives and customer service folks are trying to find alternative substitutions, or some of the fast moving items might not have hit the dock or hit the shelves yet. And so when the order is in, that case of eggs or that some of the fresh produce that we're getting hasn't gotten to the shelf yet. But by the time we pick the order, those orders are filled at a much higher rate than the order confirmation. So that was causing some confusion. And then outside of Sysco, the food industry is experiencing some challenges. One being produce. So as most of you know, in the United States, produce is grown in Zuma, Arizona, or Salinas, California. And that growing season changed right in the middle of the COVID-19 pandemic. And when in normal times when that happens, it's not as big of a deal. But in COVID-19, it increased the number of products that were discontinued because they went to new growing fields. You've heard the 2 national dairies have declared bankruptcy, and they're in the midst of trying to rebuild their business Recently, this week or late last week, we got news from Michael's Foods, our primary egg provider, that their business has been hit so bad that they are going to change some of the SKUs and reduce the number of stock keeping units they use. The chemical industry is the demand for sanitizer and disinfectant is much greater than supply, and so the ecolabs of the world are struggling to keep up. And then our press, like they are doing with our skilled nursing world, they're not helping the situation with all the challenges with the meat plants and the meat plant closing due to employees having the coronavirus. In terms of proteins, we still don't see that there will be an impact. We've been told by Smithfield and other manufacturers that they have the ability to move the volume to other production plants, and there should not be an issue with protein shortages in the food supply chain. So not a very happy story, and again, a lot of these things have made your lives more difficult, and we certainly apologize for that. But there are a lot of things that Sysco is doing right now to help support the long-term care industry and the senior housing industry. One is the ordering platform I mentioned, DSSI, is in late stages of working on a real-time order confirmation, that will have substitution. So when you do submit your order, you'll have some idea what's coming the next day. We are moving rapidly with a customer care center. So we're moving our customer support out of the OPCOs into 2 national call centers, one at our operating company in Charlotte, North Carolina, and one in our operating company in Las Vegas. We've partnered with a technology company called Cognizant that is providing us with the resources to have a state-of-the-art call center where our customers can call in and calls are being answered within 30 seconds. It's only a one-time call. The results are being taken care of immediately, and we're more than halfway through our rollout, of the call centers for all the operating companies. But most of our operating companies in the Northwest are currently being cared for by the customer care center. Delivery options. So obviously, due to the COVID-19, that we're very cautious about the passing of this virus on, and so we're asking our customers if there's no COVID-19 in your facility, allow our drivers to make a social distancing delivery, meaning we'll bring the food into your location and put it where we normally do, but we ask that nobody get within 6 feet and let that person operate on their own. If there is a COVID-19 positive case in a community, in order to stop the potential transmission of this virus, we're asking if we could do a tailgate drop where we would leave the food outside the door of the where it belongs and wait for it to be brought inside, and that way not worry about some type of infection getting to our drivers and to our employees. So that's another area we're working on. So we also have identified the key items that our healthcare customers are now ordering, and we provided that data to our operating companies, and so our merchandising folks are a little bit more in tune to what we need to bring in. And talked to some people actually this morning on the East Coast, and they've seen a marked improvement in our delivery percentages, which is a good thing. 2 areas that are really important for us and more important for you are the supplements and the thickened liquids. And when we canceled a lot of those purchase orders during the initial COVID-19 pandemic, many of the thickened liquids and the supplements were in those orders, and so we understand that we shorted our customers those products. But the POs have been written, orders have been placed, and there should be no shortages of thickened liquids and supplements going forward. The other thing that we're doing as a company is to-go containers. Obviously, the method in which you deliver your meals are in containers. And so we brought in to our central warehouse the top 20 Dynex items that are sold to healthcare. So those will be in our central warehouse, and they'll be available for purchase through your ordering platforms if you're using Dynex. Also, what we did is we went to Pactive early on in this epidemic and asked them to dedicate 4 lines to produce 9x9 and 8x8 disposable to-go containers, some in styrofoam and others in assorted paper products. And those are now flowing into our opcos, and we have plenty of inventory. And I'll share with Michael and Linda those SUPC codes. So for those of you that need to-go containers, there should be plenty available. And then last but not least is preparing for what we call the snapback. So we've gone through an unparalleled, unprecedented change to our business. Obviously, those changes have impacted our ability to provide the services that from Sysco that you're used to, but we don't want that to happen when the snapback happens. And so the company has been very thoughtful in the things that we need to do to be prepared. It appears now that the snapback won't be as quick as we may have anticipated, which will give us more time to prepare. But we certainly understand that when businesses start opening back up, we're going to need to continue to provide you the services that you would expect. So a lot to cover in a short period of time. Again, thank you for what you do. Thank you for your patience with Sysco. We're doing our best to provide you the services that you need. And with that, I am going to pass the microphone over to Michael Dragoni, who with Incite Strategic Partners.
Well, thank you, Dan. Good morning or good afternoon, depending on where you are in the U.S. Michael Dragoni, as Dan said, and I want to mirror the comments that were said earlier around, show my screen here, in thanking you all for the work that you're doing out there. We are incredibly proud for an organization that is 117 days old today. Very proud to be associated with this industry and you all. And thank you for taking valuable time to get these updates. From an agenda perspective, some key takeaways from member engagement that we've had over the past 117 days. Some of our activity and accomplishments. I'm going to provide an update on services, supplies, and equipment, or SS&E. You'll hear that acronym referenced a lot moving forward. And then talk a little bit about what's next. So from a member engagement perspective, we started with a kickoff meeting at Oregon Healthcare back on January 8th. It's amazing to sit here and reflect back, January 8th, a meeting where we met face to face, where we shook hands, where we hugged, where, it seems like a lifetime ago. And following up from that meeting, myself, colleagues, AJ, Paula, we got out into the field working with you folks, meeting with you all, better understanding your business, your pain points, and then COVID hit. But the common themes that we pulled from all of these different engagements, folks want access to more contracts. more non-food or SS&E opportunities, and educational training. So we left that meeting, very determined to try and focus on those key goals. So January 1, we kicked off the Sysco program, 427 accounts moving over onto the OHCA Incite Forum program, 500 manufacturer programs. We saw savings of 3 to 5%, some higher on a like-to-like basis. Wasn't a lot of pain in making this conversion. There's still lots of opportunities, but the focus is on driving invoice savings. In our research in establishing Incite, it was the most common thread that we heard from potential members out there was that they're looking for more value up front, and it's what partially drove our decision to pick Forum as a contracting partner. The enhanced Sysco brand portfolio, 80 different Sysco brand programs implemented. So on the right side of the right side of the screen, this just is what I could cut and paste, starting with A and going through C. But there are programs in place on applesauce, on baking mixes, on bulk sugar, on butter alternatives, and everything else that you see there, and a lot more categories. These are programs that might be a couple of pennies per case. It might be a couple of dollars per case that comes right off invoice. None of these Sysco brand programs come with rebates. They're all being driven to save money immediately right up front. So from a next step perspective around food, we're going to be focused in two different areas: manufacturer opportunities and category opportunities. So manufacturer opportunities, we now have a quarter's worth of volume under our belt. We're going to work with Forum on some contract utilization reporting. If you were buying Butterball turkey, should you be looking at Jennie-O turkey? If you were buying Kraft, should you be looking at Ventura? Those types of opportunities based on your spend in Q1. Second opportunity that we're going to focus on with you all is category opportunities. So dairy and produce. As part of our new program, there are now committed savings opportunities on Sysco dairy and Sysco produce. So when I say committed, it truly is. It's not just like the program where, hey, we make recommendations and you can buy what you want. In this case here, committed programs mean you need to commit 80% of your spend on fluid dairy or 80% on produce. And with that commitment comes a better price, comes a better pricing structure as it relates to things like produce, take some of the variability out of pricing. So these were programs that we were learning more about and getting ready to bring out to you all in March, and then COVID hit, and it's given us the time to take a little bit of a deeper look at those categories, because dairy and produce are also categories that many OHCA members buy through regional or DSD distributors. So it is now the opportunity to take a deeper dive and look at, is there a reason why you're using a regional dairy? And there may not be. A lot of you all on the call here are made up of groups that acquired companies, and sometimes it was, hey, we buy milk from Sysco, but this acquisition they buy it from Spring Valley or whoever, and we're going to let them keep doing what they're doing there, and it just kind of blends out a little bit. For us, as a brand new startup here, we look at this very holistically and want to come back to you all and say, what's the right decision for your business? And it might be 80% of your units it makes sense to buy from Sysco, and the other 20% from dairy from a regional vendor. Dairy is very topical, as Dan Locker said. There is a massive change that's happening in the dairy industry, and these dairies typically don't want to deliver anymore. They just want to produce milk. So, but dairy and produce spend can represent 20% of your spend out there. So we feel through manufacturer and category strategies that we can continue to drive even more cost savings out there. So we will be reaching out to you all in May, and chances are it will be by phone and by webinar and video conference, but we can still get a lot of things done behind the scenes to try and move the needle for you all from a cost savings perspective out there. So more to come on those programs over the coming weeks. On the SS&E, again, services, supplies, and equipment, 12 new programs implemented representing 80% of the OHCA spend. So OHCA provided us reporting to show the vendors that they track that their members are accessing, and we're proud that we've already covered 80% of the spend there, and more to come on that. And within the first 100 days, creating member-centric relationships, trying to focus on, we said at some of our meetings initially, we don't want to, it's not just a GPO in what we're trying to do. We want a very competitive program in our GPO offering. But on top of that, we want to bring other solutions to you all and focused on members and your residents out there that will just drive continuous value. So it's, again, are we operating different today than we were previously because of COVID? Yes. In some regards, it's given us the opportunity. It's been amazing. Some of the things that we've seen, things that in the past might have taken weeks or months, are now taking days and weeks instead, because people are office bound. Instead of a follow-up call 2 weeks later, it maybe can happen 2 days later, and we're taking advantage of that momentum here. So to expand upon that a little bit more, I'm going to turn this over to our Vice President of Business Development, Paula Reensterner.
Good morning, all. Thank you, Michael. I have the ability to, I guess, pick up the ball from services, supplies, and equipment. We're going to refer to this all the time as SS&E. We'll all get used to the acronyms over time, I suppose, us as well. But this is a place where we've had some really great gains in spite of COVID challenges over the past few months, which are real with this group of suppliers, because many of them are the ones that have the products that are in the highest demand. So as you look across this list, these are a number of the programs that we have implemented. And as Michael said earlier, the great part is that over 80% of the SS&E volume that was previously on the OHCA program is represented here, newly contracted. You might remember back in December, there was DocuSign campaign where you joined the Incite program and the Incite OHCA member purchasing program, and included in that package was a letter of participation for these programs. So you elected at that point to engage, and now those suppliers are working hard to get the programs rolled over, and you need not do anything else to engage. As long as that paperwork came back to us, we have the ability to make that happen. Now, there'll be an occasional additional letter of participation needed for programs that are more committed in nature or have options for more commitment. Then you will get, via communication from us, we'll send more detailed information and that opportunity to engage in a more committed program. One of the great things that we've had the ability to see in this transitioning process is the value of that forum contracting partner relationship that Michael mentioned earlier. In transitioning these programs, we saw some great savings for members. We're previously on the OHCA member purchasing program, Office Depot was the office supply company, and we're recommending the move to Staples, and folks are seeing a 7 to 9% savings. Whether it be Home Depot or Home HD Supply, 6% savings. This is something you will all be enjoying, if you will, as you transition to these programs. We're really excited for you to see those results, not dissimilar in any way to what we've been seeing on the food programs. In a similar way, we've got the 12 programs, if you will, were wave number 1. And in the second wave of programs, we are in the process of negotiating right now. There's about 13 or so, but there's a real leaning, if you will, toward medical supplies. And it really gives our members an opportunity for a higher level of engagement in an area where you hadn't enjoyed, I would say, significant engagement in the past program. So when we talk about this leaning toward medical supplies, we're creating what we call a medical bundle, which means we're going back to manufacturers in the major categories you see on the screen right now, to negotiate contracts that are portable, that are, if you will, distributor agnostic, to bring to your medical supplier reduced costs into stock so that you can enjoy the savings through your current medical supplier, assuming that they carry those products and programs. The nice thing is incontinence is already done with First Quality, and that's a very significant portion of the whole medical supply spend. But the categories that you see here listed are the ones we're in the midst of negotiating with those manufacturers. They represent well over 80% of the entire medical supply spend and are really, really impactful in the entire medical supply program. So this is, if you will, wave number 2. And what you'll see is, in the same way in our food program, some of those our manufacturer agreements drove savings. The same you'll see replicated here in the second wave, and specifically in the medical supply program being developed right now. Michael also spoke to member-centric programs. Group purchasing organizations traditionally focus on supply needs. Certainly you heard the past 2 slides, everything I had to speak about was about product. But since Incite launched, in January with OHCA, we've been really committed to doing things differently. Creating member-centric programs are absolutely one of the ways we're doing just that. So EverSign is the first of these programs where we see that it's touching the resident in a whole different way and driving more value, if you will, at the community level. EverSound is an organization that represents group listening systems that promote activity and engagement for people with low hearing or the inability to hear, by using a wireless headset system, which you see this lovely woman wearing in the picture on the screen. During today, what we're faced with, the social distancing guidelines, the objective of EverSound is to create opportunities for physical distancing without our residents feeling socially distanced. So I guess you'd have to say the timing of this product and this program for our members couldn't be any better. But I will say 600 communities across the United States use EverSound before COVID actually hit. We're going to share with you some videos. When we share this information from today's program, we're going to share some videos so you can have a closer look to really what is accomplished through the EverSound wireless headphone sets and the engagement at the community level, utilizing them for things like, music playlists and story time, storytelling, bingo, trivia, all sorts of activities that allow for social engagement without social distancing. We're also going to share with you some of EverSound's programs they have that are pre-recorded, things like visits to the Vancouver Aquarium or the National Blues Museums, things like that, that allow for different types of resident engagement and, again, without the physical distancing. Eversound is running a specific OHCA seminar actually on May 5th, which we invite you all to. Again, we will share this information with you. It's about key takeaways to safe resident engagement, which if there's anything I hear from our members, it's that where everyone's looking for ideas while residents are unfortunately, confined to their rooms. How do we keep them engaged and interested and, feeling like they're having a life? I happen to have a mother who's in assisted living, and her community uses Eversound to help with just that. So we're particularly excited about this. And I should mention that all of the revenues driven by this program, OHCA and Incite have decided to contribute to the Oregon and Southwest Washington chapter of the Alzheimer's Association. So we invite you to go to the Eversound website in the meantime, which is eversoundhq.com, to take a closer look at what it's all about. We'll be sending out information to register for this seminar and to help everyone engage in a new opportunity for physical distancing for our residents and not social distancing. I'm going to hand it back to Michael to talk about our second member-centric program from Pineapple Academy.
Excellent. Well, thank you, Paula. And here we go. So, I mentioned earlier, some of the key takeaways in education. Education was a real big one, folks, that we heard from members. The turnover that you all have with frontline staff in your dietary departments. So coming out of that meeting, I had heard of this new company called Pineapple Academy. And what's really cool is Pineapple Academy, like Incite, is 117 days old. And what they were doing beta testing last year, but their real launch in the market was January 1st, and just like Incite. And through a good friend in the industry, we got introduced to the owner of Pineapple Academy, Tucker Graves. And the training that Tucker and team have developed just seems so spot on to a number of the things that we heard from members. And for me personally, I'm a former chef, culinary degree. I've worked in food service my whole life, and when I saw these training modules, people talk knife skills. Great, okay, but it's a different knife skill to cut a cauliflower than it is an avocado or a lime or a pepper. And Pineapple Academy has individual classes for all of those. I believe there's 30-something different cutting classes. How to cut a lemon, how to cut a cantaloupe, how to cut a pineapple. I mean, for those of you in the food service department, using a knife to cut a pineapple is very, very different than using a knife to cut ham or cut a lemon. So the level of detail that they took it to was unseen to me. On your screen in the middle, essential day-to-day skills. Again, when we were talking to them in January, handshakes, how to handshake properly, for assisted living, or greeting people in dining rooms. And you know what? I bet you at some point in the very near future, Pineapple Academy is going to have a training webinar or training module on proper ways to greet. I don't think handshaking is going to be, readily received anytime soon. Is it a polite bow? Is it an elbow tap? Whatever it is, I'll but bet that there'll be a training module available. So after talking a number of times with Tucker, out of the blue, Mark Mueller reaches out to me, and Mark's a friend to a number of you all on the call and to a number of us on the call. Had the pleasure years ago of working with Mark, and Mark is an ambassador for Pineapple Academy, and I know he's spoken to a number of you about this, but we see this as great training, extremely detailed. We're believers in these modules and what they've created here, and we see ways to use it beyond the way that it's used today. We see, yes, it's an employee retention tool. There's just no two ways about it. If you all can retain 1 or 2 employees, think of the cost that it takes to recruit and train that employee, keep them longer term, develop them, have them grow into bigger positions within your organizations. But we see this as a manufacturer opportunity. How to use manufacturer's product, recipe development. We think combining both of these together can drive incredible value. And then in the right-hand side of the page, always food safe. So this is brand spanking new. We were introduced to Always just last week, but Always Food Safe is a competitor to Serve Safe. And as the Always folks say, Serve Safe is kind of like Kleenex. It's become a brand, even though it's ANSI accredited food safety training. And they have it's sponsored by the National Restaurant Association. It's a revenue generator for them. Through Pineapple Academy, we will have the opportunity to bring Always Food Safe training to you, where you'll be able to have your food service managers who need to take training like Serve Safe to be certified will be able to take Always Food Safe training at least half the cost of what Serve Safe currently goes for right now. So packaged together, we feel that this is just a great start to bringing some educational platforms to you all. Learning management systems, LMS, new acronym for me over the past couple of months, and how we can help. I mean, the Pineapple folks think that this type of training can be extended to housekeeping, facilities, janitorial, and have it be a one-stop shopping environment for your training needs. So, as I said at the beginning of our portion here, we want to do some things different. We want to bring solutions beyond just a GPO and programs like EverSound, Always Food Safe, Pineapple Academy. Again, this is day 117. Imagine what 217 and 317 is going to look like as we work closer with you all. So that brings us to the end of our presentation. I have to say again, thank you. We know how much you all have going on in your operations, and to take the time to listen to us provide updates is greatly appreciated. Mel, I think we're going to open up the lines to turn it open to the attendees to see if there are any questions that we can answer.
Okay, all attendees have been unmuted, so feel free to ask your question if you have some.
And
I think we must have been ducks in a row. Well, if there are no questions, go ahead.
Hey, Michael.
Yes,
Can you hear me okay?
I can.
Oh, this is Linda. Apologies, just to everyone. I'm not sure yet, or we will be sure of the technical difficulty, but just wanted to extend thanks promotional efforts, please do not hesitate to get in touch with us. And a couple people have emailed and asked if we will send the slides out, which we will definitely do, as well as this will be recorded.
You know, I did have I had one question sent regarding the food and procurement show that we were working with Sysco and OHCA on that actually was supposed to have been this week. Obviously, it's not happening, and you know, we have spent some time over the past few weeks trying to get a little bit of a pulse from the manufacturer community on their tolerance, their ability to get back out into the marketplace. I'm not talking anytime soon, but people are starting to ask September, October, what events can happen, can't happen. And unfortunately, there is just too much indecision, too many questions out there right now to think about a live face-to-face event. Unfortunately, I think as the world unwinds from COVID, it's going to be in a way that, you know, larger gatherings are going to be the last thing that get turned on. So we've had some discussions with OHCA and Sysco about doing some type of virtual training, half a day type session, maybe a half a dozen 30-minute presentations, looking at the potential of continuing education credits, but just trying to think of ways to bring things to you all in this environment. You know, we just don't want to sit back and wait for 2021. You know, we continue, again, driving value out there. So we'll be reaching out to a number of you to solicit feedback on potential programs. Again, you know, Pineapple Academy, I'm sure we'll have some type of a place in that environment there, but that's where we see the food and procurement show kind of morphing into for 2020. So.
If anyone has a question, in order to mitigate background noise, if you want to press the button that raises your hand in a virtual way, I can unmute you so you can ask your question.
All right. Well, if we have no further questions, we will go ahead and adjourn for today, as we know everyone has lots on their to-do list. But please, we will send out the slides. We have everyone's contact information on those, on that information, and so we just want to let you all know that we are here each and every day to support you through this. And so whatever the need, the question, we're standing beside you through this as we're all in it together. Really, really appreciate, again, everyone taking the time, and we look forward to connecting with you in the near future. And if these webinars you find helpful, please, there will be some questions, just a quick evaluation, and we appreciate any feedback or any future topics that you would like us to focus on for your benefit and the benefit of your teams. So thank you so much, and continue the great work that you're doing. Appreciate it.